Greetings, loved ones. Today we're going to talk about how to heal from trauma and PTSD, which is post-traumatic stress syndrome. It's a really important message. This is part 1 of 2. So help us get these messages out. Please subscribe to our YouTube channel. Follow us on Facebook, Instagram, and Twitter. Hit the like button. Hit the notification bell. Comment. Give us comments on what you think about the content. And please share these messages with others. You could save a life. So how do you recover from trauma and PTSD? Dr. Meg Seymour from the National Center for Health Research gave us this information. She wrote, as many as 1 in 11 adults in the United States will be diagnosed with post-traumatic stress disorder in their lifetime. PTSD can develop following a single traumatic event, such as a natural disaster or a sexual assault, or long-term repeated trauma such as childhood abuse. Many people have experienced traumatic events in their lifetimes, but not everyone who experiences trauma will develop PTSD. There is no way to perfectly predict who will develop PTSD following a trauma, but researchers have identified some traits that make it more likely that someone will develop it. For example, someone is more likely to develop PTSD if they lack social support, or they were younger when the trauma occurred, if they were female, or have a prior history of mental disorders. Those who develop PTSD keep reliving their trauma over and over, and their nervous system is stuck in this fight or flight mode. Common symptoms of PTSD are re-experiencing the trauma through flashbacks or bad dreams, avoidance, and feeling jumpy or on edge. Some lesser known symptoms of PTSD are how it can make people feel emotionally numb or even cause problems with attention, memory, and learning that they look similar to symptoms of attention deficit disorder. Many people try to avoid thinking about their trauma, but research has shown that denial or trying to repress the trauma leads to further distress. If you are struggling to psychologically recover following trauma, or if you're concerned that you have developed PTSD, there is hope. There are several types of therapy that have been shown to be effective for helping people recover from trauma, and this lesson will help explaining them to you. So, what are the types of therapy that are available for people who have experienced trauma? So the first one is cognitive processing therapy. Those who have experienced trauma, sometimes they avoid thinking about what happened to them as a way of coping with the trauma, but avoiding painful memories that can actually interfere with recovery. In this CPT, it helps people identify their stuck points, which are the parts of their trauma story that are the most difficult to revisit and overcome. CPT helps people change harmful beliefs, such as rape victims who blame themselves. One activity in CPT is writing a trauma narrative, which is the story of the trauma, and then reading it out loud to the therapist. This can be done as either individual or group therapy, and both versions of CPT have been shown to help relieve symptoms of PTSD. A study from 2012 followed up with rape victims after they completed a CPT program and found that only 22% of patients still had PTSD 10 years after completing the therapy. That's pretty cool. So here's another form of therapy. It's called Dialectical behavior therapy. So this type of therapy can help those with PTSD, called Dialectical behavioral therapy, or DBT. I'll use DBT, it's much easier to say. DBT teaches skills like mindfulness, tolerating distress, and learning to handle negative emotions without feeling overwhelmed or depressed. A study from 2020 compares CPT and DBT for helping victims of childhood abuse, either sexual, physical, or both, who had PTSD. Although both forms of therapy helped reduce symptoms of PTSD, DBT patients showed even more improvement than the others. Then there's another form of treatment called eye movement desensitization. I wish they'd make these words easier. Eye movement desensitization and reprocessing. This is known as EMDR, and we're going to stick with the EMDR. It's a therapy that was developed for treating post-traumatic stress disorder. In an EMDR session, the patient describes a traumatic memory while stimulating both sides of their brain. This is often done by moving one's eyes in order to follow a moving light or following the therapist's finger as it moves from side to side. So I'm going to stop here and show you. So basically, you have to keep your eye on this, and you have to keep your eye on this as it's moving while you are telling your story. And sometimes EMDR is done with sound in alternating ears or by being touched on alternate sides of the body while recounting the traumatic memory. The idea behind EMDR is that moving the attention back and forth between left and right will stimulate both sides of the brain. And it is believed that talking about the traumatic memory while both sides of the brain are stimulated will help change how the memory is processed by the brain, ultimately reducing the negative emotions that come from recounting the memory. Some researchers believe EMDR works because activating a traumatic memory while focusing on something else can reduce how intense that memory feels. There is disagreement over why EMDR works, but regardless of why it works, it has been shown to be effective. EMDR has been shown to treat PTSD in several studies, reducing symptoms and removing diagnoses. For example, one study found that 80% of PTSD patients who did EMDR therapy had their diagnoses reversed. They were cured, in other words. However, there is some other evidence that it is unclear whether or not EMDR is more effective than other forms of therapy. So here's another form of therapy. It's called somatic therapies. That one's much easier to say. Thank you. Unlike many other therapies, somatic therapies do not require patients to extensively or fully describe their traumatic experiences. Instead, they teach patients to reduce the negative feelings of remembering the trauma through working with how their body responds to feelings of threat and fear. Many other therapists try to reduce physical symptoms of trauma by changing a patient's thoughts, but somatic therapies work on changing negative feelings by changing how the patient experiences the physical symptoms of trauma. Somatic therapies are based on the neuroscience of how trauma affects the body, helping patients feel safe in their body and teaching them to regulate their emotions while working on skills like bodily awareness. These therapies are more recent, so there is less research on them, but the research that exists is promising. For example, one study looked at the effect of somatic therapy for people who survived a tsunami, providing every participant with somatic therapy and following up 8 months later to study the effect of their PTSD symptoms. 90% of the participants showed over a 50% improvement in their trauma symptoms such as jumpiness or recurring thoughts and avoidance. A clinical study from 2017 looked at the effect of somatic therapy for people with PTSD. Patients were either assigned to receive somatic therapy or were assigned to a wait list and were eventually given somatic therapy. Diagnosis of PTSD were reversed for 44% of the participants, and participants also experienced a reduction in depression. It sounds like there is hope for healing, and maybe one or more of these therapies can bring healing to those who have suffered trauma and PTSD. But remember, the question is not if you will encounter a victim of violence. The question before God is, what will you do when you do encounter them? You could be the person who saves a life. You could actually prevent a suicide. You are called. We are all called to be champions for justice, and those who suffer violence and trauma They need to know that those who love them and those who don't even know them will step out and help them before it is too late. If you're a victim of violence, I want you to listen to me. You are valued. You are loved. You are intelligent. And yes, you are worthy. I keep on saying this, but I want to say it over and over and over and over, because if you've suffered abuse or trauma, you don't believe this. This is the truth. You are valued. You are loved. You are intelligent. You are worthy. And God, He doesn't want you to suffer with trauma and violence. He wants you to heal and live free from violence and peace and tranquility. And I want you to know that there is a way out. Abuse is not love. If someone abuses you, they don't love you. And it's not your fault what happened. And most of all, I want you to know that you're not alone. If you are a victim of trauma or abuse or violence, reach out to someone today. If you find yourself in a dangerous situation, dial 911 for help. If you know of anybody who's suffering trauma, get them the help they need to heal. And if you know of anyone who's suffering abuse, tell the authorities. In our next episode, we're going to do part 2 of this, and we're going to continue to talk about how to heal from trauma and PTSD. Until then, God bless you.